Zevalin Kit is a medication that is combined with a certain radioactive substance, Yttrium-90, and used along with rituximab to treat a certain type of cancer, B-cell non-Hodgkin's lymphoma, in patients whose cancer has returned or has not responded to other treatments. Ibritumomab, tiuxetan and rituximab are known as monoclonal antibodies. They work by killing certain blood and cancer cells from your immune system, B cells. Yttrium-90 helps kill the cancer cells. It is important to follow the dosage instructions provided by your doctor and to take Zevalin Kit at the recommended times for the best results. Zevalin Kit is administered through an injection into a vein by a healthcare professional. The dosage is determined by your medical condition, weight, and how you respond to the treatment. If you experience nausea, vomiting, diarrhea, abdominal/stomach pain, cough, dizziness, headache, flushing, or loss of appetite, it's important to let your doctor or pharmacist know as soon as possible. While using Zevalin Kit, you may experience serious side effects, but your doctor has prescribed this medication because the benefits outweigh the risks. Your doctor will monitor you carefully to reduce the risk of side effects. Immediately inform your doctor if you experience pain or swelling at the injection site, swelling in the ankles or feet, changes in mental/mood, such as anxiety, black stools, vomit that looks like coffee grounds, or vaginal bleeding. Seek medical help right away if you experience weakness on one side of the body, vision problems, confusion, or trouble speaking. In rare cases, this medication has caused other types of cancer, which can lead to serious blood disorders. Be sure to look out for symptoms and consult the warning section for more information. Although rare, a serious allergic reaction to this drug is possible. If you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. When using the Zevalin Kit, it's important to be aware of potential serious side effects that may rarely occur. These can include severe breathing problems or heart problems, which can be life-threatening. It's crucial to seek immediate medical help if you experience symptoms such as trouble breathing, itching, swelling, severe dizziness, or chest pain. Additionally, this medication may cause very serious blood disorders, leading to low blood cell counts. This can result in anemia, decreased ability to fight infections, and increased risk of bruising or bleeding. If you notice signs of infection, easy bruising or bleeding, unusual tiredness, or a fast/pounding heartbeat, it's important to inform your doctor right away. In rare cases, serious skin reactions, such as Stevens-Johnson syndrome, have occurred in patients receiving this treatment program. If you develop a rash or experience pain/swelling in the mouth, tongue, throat, or eyes, it's essential to seek medical help immediately. If you have previously had a severe skin reaction due to Ibritumomab, tiuxetan or other medications used in the treatment program, it's crucial not to start the treatment program again without consulting your doctor or pharmacist for more details. Before taking the Zevalin Kit, make sure to inform your doctor or pharmacist if you have any allergies to this medication or other medications used in the treatment plan. Also, it's important to discuss your medical history, especially if you have any blood or bone marrow disorders, or if you have had recent/current infections. Be cautious when taking this medication, as it may cause dizziness. Avoid alcohol or marijuana, as they can increase this effect. It's important not to drive or operate machinery until you know how this medication affects you. Also, be mindful of using sharp objects and participating in contact sports, as this medication may increase your risk of getting cut, bruised, or injured. Additionally, be sure to discuss with your doctor about receiving immunizations/vaccinations while using Zevalin Kit, and avoid contact with people who have recently received live vaccines. This medication may also increase your risk of getting infections or make current infections worse, so it's important to stay away from anyone who has an infection that may easily spread. If you are pregnant or planning to become pregnant, it's crucial to talk to your doctor as this medication may harm an unborn baby. Reliable forms of birth control should be discussed with your doctor during treatment and for 12 months after the last dose. Breastfeeding is not recommended while using this medication and for 6 months after stopping, so consult your doctor before breastfeeding. Finally, it's important to consult with your doctor or pharmacist for more information about the risks and benefits of this medication. It's important to be aware of potential drug interactions when taking Zevalin Kit. Certain medications can change how Zevalin Kit works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Zevalin Kit include drugs that affect the immune system, such as azathioprine or corticosteroids, as well as drugs that can cause bleeding or bruising, like blood thinners or antiplatelet drugs. If you are prescribed low-dose aspirin for specific medical reasons, such as heart attack or stroke prevention, it should be continued as directed by your doctor. Be sure to ask your doctor or pharmacist for more details about any potential interactions with Zevalin Kit. If someone has taken too much Zevalin Kit and is showing serious symptoms like passing out or having trouble breathing, it's important to call for help right away. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include signs of infection that won't go away, fever, easy bruising or bleeding, unusual tiredness, and a fast or pounding heartbeat. If you're concerned about an overdose, seek medical help immediately. It is important to have lab and medical tests, such as a complete blood count, platelets, and blood pressure, while using the Zevalin Kit. Make sure to keep all medical and lab appointments and consult your doctor for more details. Make sure to take each dose of Zevalin Kit as prescribed by your doctor. If you happen to miss a dose, be sure to speak with your doctor or pharmacist to determine a new dosing schedule. This medication, Zevalin Kit, is administered in a clinical setting and is not meant to be stored at home. It is used to treat certain types of non-Hodgkin lymphoma. The dose and schedule of Zevalin Kit will be determined by a healthcare professional and will depend on the individual's medical condition. It is important to follow the healthcare professional's instructions for the proper use of this medication. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.